I am a proud McNair Scholar at the University of Cincinnati. I decided to do my research on the environmental risks and health outcomes in underserved populations. I did this research with Dr. Michelle Burbage, Abigail Cuyler, and of course, myself. So, a little introduction about me. My name is Tina Johnson. I'm a third year public health major with a concentration in healthcare administration. I have certificates in minority and global health, and I have a passion for health equity and making sure everybody knows their health needs, which can be affected by environmental concerns. So, this is just a little breakdown of what we're going to be going through today. We're going to be going through the background and why we decided to focus on environmental health, our purpose and why we decided to focus on Cincinnati community specifically, methods and how we did the data collection and marketing, data, the final data of the most alarming things we saw. This won't be all the data because we collected a lot. And then conclusion. So, our summary and our next steps. So, this is our background. I'm going to share that with you, which is the introduction to the research project. So, for the background, 24% of global deaths linked to environmental factors. And then there's gaps between awareness versus action from like lead and radon exposure. And then climate change increases health risks. There's limited data on Cincinnati community awareness, which is why we decided to focus on this. In the Midwest, including Ohio, increased extreme participation in drought have led to flooding, crop damage, and environmental instability. However, there is limited information on the Cincinnati community knowledge regarding environmental and climate related health risks. This study that we created aims to address these gaps. So, our purpose, why are we doing this study? We have three core reasons: examine, understanding, and elevate. The purpose of the study was to examine the environmental conditions experienced by residents in low income Cincinnati communities and understand how these communities impact health outcomes. Rather than relying on existing data, this research centers community voices by collecting firsthand information directly from residents about their lived experience. So, next, I will be talking about how we collected the data. We had multiple approaches on how we collected the data. We utilized the community based participatory research, also known as CBPR. It's a collaborative research approach we use that centered community voices in identifying environmental health concerns and shaping data collection. We didn't want to assume. We had a partnership with CRAB, which is basically a community advisory board where they live in the communities that we studied and how to make the survey better and how to make people actually want to take the survey in those communities. We did a survey distribution in those low income communities such as College Hill, Price Hill, Avondale, and more. These are just low income areas where people experience more disparities. Like as I said, we did focus areas. We focused on areas where there was a big environmental exposure, climate related concerns, and perceived health outcomes, and people who had limited access to resources. So, next, I'll be sharing some crucial data points we saw in this project. So, for our lead, we asked participants how concerned they were that lead was in their paint, water, soil due to the lack of testing, and 57.3% of respondents said they were very concerned. For our data on air pollution, 57.9% of respondents were very concerned about the air pollution in their area. A lot of people expressed that a lot of factories were being built in these areas, which made the air worse, and they saw more health concerns. Next, we have mold, which is what a lot of low income areas experience due to the houses being old and aging and nobody really comes out and check.